Hello and welcome to the Happy Healthcare Professionals live show. I am here coming to you from Wednesday, a balmy Wednesday afternoon, which I'm very excited about because the sun's shining and it's amazing. And I am so excited about today's conversation. As always, I love having these conversations. Now, if you don't know who I am, then let me introduce myself. My name is Komal. I am a career coach and business strategist to pharmacy professionals. And I absolutely love helping pharmacy professionals to excel in their careers, create new paths for themselves, and really bring the future of pharmacy forward. So I am super excited today because I have been wanting to have this conversation about pharmacists moving into PCN land for some time. And in all honesty, I couldn't have a better person to have the conversation with. So today's guest is Tara Humphrey. She is the founder and the managing director of THC Primary Care, and she's got over 20 years of experience in business development and operations management, covering both the public and the private sector. She's even got an MBA in leadership and management in healthcare, and she provides project and network management and training to primary care networks. She provides coaching support as well. And if you don't already follow her, then you must go and follow her because she is the host of the Business of Healthcare podcast, which is an amazing podcast where she interviews incredible professionals, healthcare professionals around their businesses. And without further ado, I'm going to bring Tara on screen. Hi, Tara.
Hey. Thank you so much for inviting me. I really appreciate it.
It's an absolute pleasure. I'm really, really excited to have this conversation because pharmacists in PCN land is still a new space. And so, it's a conversation I've been wanting to have for some time. But before we go into that, tell me about yourself. Tell me about your career and your background and how you kind of came to setting up THC.
So I've got quite a varied background. I mean, I've worked at McDonald's, I've worked in insurance, I've been a barrister's clerk, but I used to be a business development manager at a university, and I was kind of given a project where I was working with some GPs, and I was like, oh my God, sounds silly. I never realised GPs, I went to go and see GP, like a doctor, but I never ever kind of thought of them as any people that I could work with. But I was kind of given this project. And then when it was time for me to leave my job at a university, one of the GPs, a guy called Mayor Vibuti, said, would you write a business plan for us? And I said, yeah, could you pay me? Because I'm not going to have a job. And he said, yeah, have you got a business? And I was like, yeah. And then I kind of went home and was like, how do I set up a business? And then I set up a business. And yeah, we've been going. We celebrated our 7-year anniversary on the 17th of March, which is my birthday. Yeah.
Oh, amazing. And so what does THC actually do?
So we provide interim network management to primary care networks. So we typically attract the networks that are maybe struggling to recruit a PCN manager, or they've had a PCN manager that's left and they're like, I need somebody, or I need a team that can hit the ground running. So we provide that. I also do facilitation. So sometimes people just want me to come in and facilitate a conversation. We do any specific projects. I'm it used to be part of the Time for Care team. So that was facilitation around quality improvement. And I kind of call it like play. Every now and again, we will get somebody message us and say, could you do this? And we think, yeah, go on then. So we've got a bit of free time where we just take on really exciting projects. And one of those projects was bringing together some chief pharmacists in Kent and Medway and helping them create their medicines optimization board, which I absolutely loved. Yeah.
Well, I'm going to jump on that one, Tara, and ask you more questions about it. But, pharmacists in PCN land, they've been around for a while, but it's still considered to be a fairly new role, right?
I mean, the networks that I am part of and have been part of, they don't see it as a new role. Like, I think they understand what a pharmacist can do in other networks. It depends on the nature of the practices in the PCN. So some practices have already got a pharmacist.
Yeah.
It's different from a PCN pharmacist, but they understand the role. I've met networks even today, they don't have any additional roles and they've never had a pharmacist. So it depends. I wouldn't say it's a blanket approach. I think some are very well versed and know how to utilize the skills of a pharmacist. There are other networks that will be thinking, what could a pharmacist do for me?
Yeah.
I don't get it. I don't understand. So luckily, I attract the networks that do understand what a pharmacist does.
Which is amazing, right?
Yeah.
And how have you found, and this is where I really want to have the conversation around kind of what are the kinds of barriers that pharmacists experience when they go into a PCN? And I know you've mentioned when we've had the conversation about this before, because you tend to end up working with PCNs who are really familiar with pharmacists. You tend to find that they already understand what a pharmacist does and what they can potentially support them with, right?
Yeah. So you've just answered your own question. So the main barrier, and don't get me wrong, we do work with networks that are struggling with all of the R's roles, and it's a lack of understanding of what the role can do. And I think because of how networks came to be and the funding that is available, and I don't mean to be derogatory, sometimes the R's funding is like a pick and mix. It's like, okay, well, I can have a pharmacist, I can have a dietitian, I can have this, I can have a physician's associate, and they put the role out, and then that person comes, they've recruited the role, and they think that they're clear. They're not clear. They're not clear on what this person can do. And because the role, and when I really started to get involved in this was during the pandemic, where if you're not sitting, they're not sitting in one practice. So each practice works slightly differently. And I think practices are kind of, and I understand there's nothing wrong with this, they're thinking like appointment slots. And I think, so that's the barrier. It's making sure it's that role clarity, really clear on what they're going to do, giving them a really solid induction. And then making sure that they have got the support, they've got that clinical supervision, they don't have to justify why they need to go on like a workshop for their CPP pathway. Those are the barriers, and it's because the network hasn't had the time to really sit down and really think about it. And now, and one of the networks that we've got, and it's for a slightly different role, we've got the job description, and I'm like, before we put the job description out, what is this person going to do in the first 90 days? Otherwise, they'll start and you'll think, well, can you just do this? Go off and do it. And they struggle because they don't have that infrastructure around them.
That's a really important point, actually, about that really understanding what it is that they want to get out of that role, and then working from that place, right? And having that as the basis of, I love what you said about what do you want them to achieve in the first 90 days. When you start a new role that nobody's filled before, I know what that feels like, because it's like there's almost too much level of autonomy on one side, and then on the other side it's kind of like really trying to understand that, go back to the values and the why and what it is it's being achieved.
Definitely. And each practice works slightly. You've got the culture of the network, and then you've got the culture of each practice. And some PCNs are like, it's like a hub model where you've got like a team of pharmacists, and it doesn't matter kind of where the patient is, they'll log in and they will process whatever that piece of work is or support the patient. And in others, they want to feel like they own the pharmacist, and it's trying to iron that out before the person starts. And I think we've had, I've seen Cranbrook PCN's praises on this, and I did a webinar with Renaz and Sadia, who I absolutely adore. They made my job. They make me look really good, but they were exceptional. They were excellent. But the key success factors were, we had a really good induction. We introduced them like in person to each of the practices. And then we started with high risk drug monitoring, the Eclipse alerts, and then they started on their CPP pathway. And now that's how everybody comes in. So it's like statutory mandatory training, high risk drugs alerts, the eclipse, like blue, red, yellow. And that was a really helpful kind of way to get them introduced. And then there was this tussle around appointment times and like how long is the amount of conversations we had with how long does it take to do an SMR? Like a doctor would say, it take me like 2 minutes. And then other people are like, well, it's an hour. And so things like that, trying to work through that, and giving the pharmacist my approach is I want to give people in more than enough time. If they're learning, they want to make sure you guys are so precise. You want to follow the exact standard operating procedure, and that's clinically safe. So let them do that. And then there'll be patients they zip through, and there'll be patients that take a little bit more time. And over time, it averages out. And you have to trust your team, trust the person.
Yeah.
And there's that performance management, and you all know, but give them a solid induction. And then after induction, if you start to see red flags, but I would probably say it's not the pharmacist, it's how they were introduced to the role.
Yeah.
Within the person.
Yeah. And that, that message is across the board, really. Whatever structure the pharmacist is going to be working in is so important. It goes back, and I'm sure that you would say the same for all of the roles within the PCN. Yeah. It's like you go back to basics and say, okay, what is it that you want to achieve? And, how are we going to make sure that this person just gets an absolutely amazing induction? They got a really full understanding and breadth of what happens within the PCN and where they sit within it. And they've got a really clear understanding of what they want, what they have to deliver.
Definitely. And that's the support. So I suppose my role as the manager, even though, although, like you pick up things along the way, it was like, I'm not your clinical supervisor, but if you are unhappy about anything, if you are not sure about anything which is not clinical, you call me. Don't sit there struggling. And that was my role, to make sure that they were well taken care of. And we had one-to-ones, we had group PCN meetings, we had the WhatsApp group. So that stuff, we started, Renar's, it was her idea to start educational sessions. She led with the COPD masterclass. So my job, I think the job of the PCN manager or the PCN leadership team is just to give them what they need. There's a boundary, but I've never come across anybody that's rubbed up against the boundary. All the requests are, pretty basic, pretty simple. I think give them a structure, but also allow them to deliver their work flexibly. And I think where they feel like they're micromanaged, and when they say, like it's a half an hour appointment slot, and then it's like 10 minutes, it's those things. But we've had a couple of issues where we just talk about it. And usually it's a misunderstanding, but I have seen in other networks a mismanagement of expectations around play and career progression once they have completed their CPP pathway. So you want to sell the role, but we do have to be realistic with what we can offer, because they'll go through that pathway and then they leave, understandably, because their expectations have not been met, and then both parties feel a little bit aggrieved.
Yeah, that's a really important point, isn't it? About and also from I'm looking at it from a pharmacist perspective, in terms of you also, in terms of your own personal career development, have to be clear on what you want to achieve out of being in that PCN and where you want to get to as well. And I think that's a really important thing to lay out on the table, especially when you are looking towards moving into a PCN role and you're thinking, okay, this is what I'd like to have happen. And it's that honesty and being really upfront and just being honest about what it is you want to achieve. And that's when the two things have to align, right? Your desire to work in the PCN and what you want to achieve versus the PCN's objectives.
People aren't honest, but also it's a tiny, I don't know if it's a chicken and the egg. I don't know if, so you don't know what you don't know. So I think in a practice, might be a bit easier, but in a PCN, they may not know. They may not, I don't know crystal clear, okay, well, I want this, I want this, I want that. and then I'm going to get this. I don't know. I would be looking, and I am looking for pharmacists all the time. I suppose you want somebody that wants to progress in the network and wants to take a clinical lead in certain areas. So we do want clinical leaders, and somebody that is passionate about education and training and mentorship to help foster kind of that next, like the next wave of pharmacists coming in. And when thinking about contract areas, I'm looking for pharmacists that want to progress into a leadership role. Your title may not change, but your portfolio responsibility increases.
Yeah. That's a really important point. I think, to anyone listening to this who's thinking, okay, well, I want to go into PCN, perhaps they're working in community pharmacy or they're working in another part pharmacy and thinking, I'd really, really be interested in going into a PCN. That's a really important point that you've raised about really, having the idea that leadership is a possibility within PCN.
Yeah. Can you hear me okay, Komal?
I've just lost you temporarily, but I think you've come back now.
Oh, okay, cool. So that's what I'm looking for. I can't speak for all networks, but I think, and it's somebody that's proactive, because you sometimes can't always see what needs to be done. If you've got 8 practices or 10 practices, so somebody that is proactive, and I think Renaz and Sadia were, they had a passion for Renaz had a passion for COPD. She went to the practice and she was very, very, she was allocated a couple of practices and she really found her feet, but she was proactive. It wasn't that it was like, when asked, can you do this? And she would go off and do it. And then, can you do that? She started to spot and build those relationships. So that's what everybody's different, but I did message Renaz and was like, I need another Renaz. Find me another you. They were so good. They were so good.
And how have you seen the role of the pharmacist? I mean, you've kind of touched upon this already, but have you seen the role of the pharmacist evolve over time in the PCNs?
Well, one of our PCNs, is the co-CD pharmacist. So
amazing.
I think it's leadership, and it's not. I get the profession. Everybody's very protective of their profession, and I'm like, I've got my manager badge on, and but I think it is just. I think all roles have the opportunity to progress. I think that the reality is, it may not be up. It is. It's broad and it's wide, and then it goes back to your point around what do you want. If you want to be the chief pharmacist, and I don't know if I should say this, if you want to be the chief pharmacist, this PCN it might be a stepping stone to where you want to be. And the reason why I say I shouldn't say this is because I want you guys to stay. I want you to stay. I know. But if you want what we can give, I think is a fantastic work-life balance. Fantastic work-life balance, the opportunity for variety, and the opportunity to be a trailblazer in your area. The challenge of being a trailblazer is that it's difficult because you're one of the first, and people may not understand all that you can do. So sometimes there is a little bit, I have to prove myself. But I think, education, training, mentorship, multi-professional education and training, and getting involved in your training hub. I think it's sometimes, every time I speak to a pharmacist, I spoke with Anisha, I know, Preeti, I'm like, if I wasn't a manager, I'd want to be a pharmacist. So I think, short answer, I think how the role progresses is I see more pharmacists taking up leadership positions and being able to say, well, actually, from a medicines optimization point of view, from a cost savings point of view, from a prevention point of view, this is how what I bring to the table. And people thinking, like, fantastic, like, pull up a chair, you're staying. Yeah.
Amazing. I mean, I think there's when you see the when you put it that way, there's really so much potential within the PCN, right? There's just so much, there's potentially so much opportunity for pharmacists, but as you said, a lot of them they're trailblazing a path that hasn't been created yet, and that takes a lot of courage and support to be able to deliver on that, right?
Definitely. I think that, and I know some pharmacists have had a really tough time. I know loads of roles that have had a really tough time. It's hard to, and I think when you're maybe working from home and you don't have the only feedback you receive is negative because no one cares about the good work. That is really, really, really tough. And I think trying to find some allies in your network and be visible, don't hide behind your email, pick up the phone when a practice says you can come into practice, but it's not, because a funny invitation. It's not like come into the practice at 10 and it's not a meeting. It's like they'll say come into the practice, and it's a little bit of like a throwaway comment, go into the practice and like network and ask people, just that genuine chat to the receptionist, chat to another pharmacist. It's that know, like, and trust. And it sometimes can be hard because you feel like, God, I just want to get on with my job. Can I just do my job? But I think in all walks of life, if you can develop that rapport and strip away all of the titles, that can go so far. So my plea to any role but pharmacists today is that if you haven't been into your practices, go into your practices. If you don't have regular one-to-ones with your manager, proactively say it'd be really good. And sometimes you have to lead. You have to lead, and you shouldn't have to all of the time. You shouldn't have to, but sometimes you are required to. And that is tough. I'm not going to lie. Sometimes it may not be a nice position to be in, but I think that's the reality. If you love your job and you see the potential in your role, it's like what you always be thinking, what can I do? What can I do? Who can help me? How can I be proactive? If the culture of your network is like, how do I put it? Crap.
Just be honest.
Like a professional better word, not great. It's crap. You have to really think, it's your life, it's your profession, it's your career. What can you influence and what can you not? There are networks that are amazing, absolutely fantastic to work with. Not perfect, but they want to be great.
Yeah.
And they're open to feedback. And I think those are the networks you want. I think if there is a turnover of staff constantly, do your research.
Yeah.
What's the work there? Speak to the manager informally. What are you looking for? I say to people, like, what are you looking for in a manager? What do you expect from your manager? It's the same with a pharmacist. What are you looking for in a pharmacist? Describe the culture of your network. Really do your research. It's not so much. I think pharmacists are a hot commodity. You guys are a hot commodity, so you can choose where you want to be. You don't have to put up with where you are.
That's really great advice. Really great advice about, do your research, network, have those conversations beforehand, really understand the PCN, understand the turnover of staff. I want to come to Shilpa's comment, because Shilpa, thank you so much for listening in and putting this here, because Shilpa said, totally agree, Tara, PCN pharmacists are growing, but they aren't always being represented at stakeholder meetings as the role is so varied in each PCN. This is very different to other sectors such as community pharmacy, where we have the LPC and the secondary care, where you've got chief pharmacists and, who are supporting and guiding them. And that's a really important point, actually, because maybe that's one of the reasons as to why, you know, pharmacists who go into PCN, you know, into PCNs might struggle because there isn't that kind of, you know, representation. What do you think about that?
No, I know, I would agree, and I think that there is. We talked about pharmacists, talked about the manager, the role of the leadership team, your CD, and I think what I've seen and been part of what's worked really well is when you invite your team, your PCN team, to the meeting and give them the opportunity to showcase what they're doing, what is working well, what are the issues, and I think it gives each person the opportunity to kind of speak up. And I think it may not be the right, I don't know if it's the right approach, but sometimes if Renaz hadn't have spoken up, I may not have wanted to lead. She was session. Can you see me now?
I can see you now.
Can you see me now? If I had not spoken up, I may not have seen her in the way that I see her now. So the leaders have to give all of the team the opportunity to speak up and present. And then it's the opportunity for the person to say, actually, I am going to be proactive. I'm going to lead. Not everybody needs to be a leader. And I think from a business perspective, you need A, B, and C players. You don't need everybody to want to be a leader. Some people do want to just do their job and go. And that's great. Some people just want to do their job to the highest standard and not think about it once they have finished their work. Other people don't want that. Other people are thinking, oh, what can I do? What can I do? There's an opportunity here. I'll go to this conference. I'll do this. I'll do that. So I think that those people need to make themselves visible if that's what you want. And the job of a manager, the job of a leader is to spot that talent and then create the opportunity and say, you can come along, you can represent in that meeting. And, you know, like, you do it. You don't need it. And so I think we have to grow our leaders from within our. That's how we'll keep them. And then hopefully they'll be given opportunities, or they'll take those opportunities. So then when those are meetings, you know, now I've been exposed to the wonderful world of pharmacy. When I'm in meetings, I'm like, okay, well, where is a pharmacy representative? Well, what about this? Yeah. What about X? So if I hadn't have been given those opportunities, I wouldn't know. So as a manager, and it's not about PCN management, you have to take the time to learn about each profession. What can they give? Like, tell me what you do. I will say to people, like, imagine I'm your patient. And I'm on gabapentin, which I need to go off. I'm on gabapentin and I've got all these ailments. To walk me through a structured medication review.
Yeah.
And it's like the job of the manager needs to understand, and then I can advocate for you. Then I can speak confidently in the meeting about the expertise that X, Y, and Z brings to make sure we're not missing a trick.
Yeah. Yeah.
That didn't answer short.
It's so important what you've just said about, you know, being the advocate, but you got to turn it on its head. You create the advocates by talking about what you do and what you can deliver and sharing that information with others, because that's how people will know what a pharmacist does and what they can support with. Shilpa's asked a question. She said, how do we get this information out to the ICS on what's working well and what's not, so that we can learn from that?
So in Kent and Medway, which used to be Shilpa's patch, you guys they just had a conference where they literally asked the pharmacists what is working well, what would be even better if, and what are the challenges. And a lot of it was around like a lack of, you know, like joined up working, and ask them what the solutions are. So that was the ICS leaders coming together to say, we want to improve our pharmacy profession. What do you guys want? The next stage is what can be turned into tangible action. So ICS leaders, PCN leaders need to look at all of the profession. I think the full stop take is looking at this, is looking at the workforce, and how can we make primary care and primary care networks an attractive place to be. within the system. So you've got community. So we're not fighting, like we're not robbing Peter to pay Paul. How can we create a workforce that can navigate around the system? So you may not love primary care networks, but actually you can progress into community, and they're seen as more of one workforce. So I think ICSs need to ask, but they need to ask and then be willing to act on the feedback. Some of it's tough around terms and conditions. That needs to be addressed. And I think whilst everybody's on different terms and conditions and agenda for change, that is a big barrier, a really big barrier. And it's like, who is going to make some difficult decisions? These are hard decisions. But on the flip side, if your chief pharmacists come together and they've got a shared purpose, you can promote change. So I think the ICS leaders, and for people, I'm like middle management, for me to be like, hello, this is what I've got to give. This is my 2 cents, and this is why it's important.
Yeah, that's a great way of looking at it, Tara. To bring those individuals together and ask pharmacists the question, because going back to your point earlier about it's one workforce, they're not competing with each other, they do different things. I think there's always been this kind of perception. It's like, in community pharmacy, there's this perception of, the pharmacists are all going into PCN land, they're all going into GP practices, but they are all doing different things within the wider NHS network, right? And there can be a lot of collaboration between the two. And what I'm finding is I'm seeing a lot more pharmacists doing portfolio roles, where actually they're doing some time, they're working some period of the time in GP practices or in a PCN, and they're also working in community pharmacy. And that brings a new dimension to the knowledge, which I think is so amazing, actually, that we've actually brought ourselves into this position where those possibilities are even there.
Yeah. I think the portfolio role for all of professions, I think, is amazing. It gives you insight. It just makes your skill set extremely valuable, because you can understand attention. The frustration sometimes or often comes through a lack of understanding, like, why are they doing it that way? And it's like, well, they're doing it this way because this is what they think, and this is their process, and this is their system. So the pharmacist, you can bridge the gap if you're coming from different areas and you are the change agents, and there's no title there. You are just slowly beavering away and making those connections, because I think primary care is heavily dependent on personal relationships. It's not just like this is a process and everybody follows it. So being able to see the other system point of view is really important. And then the leadership comes from, how do you communicate that? So it's not like, well, in my old job, I did it like this. Yeah. You can learn how to influence, communicate, to subtly shift the dial, because you can appreciate the other person's perspective.
Yeah, I've just thought of something, actually, whilst you were saying that, actually, is that one of the things I think it helps to develop is a person's soft skills that ultimately are going to be transferable across. And I think that's often a neglected area, because as clinicians, it's so easy to just sit in the space of, this is the pathway, this is what we need to do, this is what we have to do in order to protect the patient. And you kind of can lose sight of the soft skills that are needed, the relationship building that's needed, the real time taken to understand the processes in all these different parts of primary care, and then be able to have, I think pharmacists have that unique perspective, because they can see from all different angles. And that I think is what happens when you develop these portfolio positions, and you can really start to kind of like, develop your soft skills in doing so.
Definitely. I don't know why they're called soft skills, because it's quite enough. But I think takes time. It takes through learning, and then it kind of, like learning by mistakes, learning through difficulty, being in difficult situations, and then being tough enough, resilient enough to kind of show up to work the next day and think, okay, how are we going to approach this? So I think it's really, really important. And when opportunities come up, like time for care, I would say to people, if you get the opportunity to do a time for care course, anything, take it. Absolutely take it. That was one of the courses that been excellent for me. You don't need an MBA, but I think communication skills, managing conflict, negotiation, even just like what I watch so many podcasts. It doesn't have to be formal training at all.
No.
It can just be learning from somebody that does it day in and day out, and then just taking one piece of advice and like, I'm going to try and apply that this week. If you've got somebody that's like, you just keep butting heads and you're just not getting there, it's like, right, this is my leadership challenge. How can I move us closer together?
Yeah, it's a great mindset flip on that. This is a challenge that's come my way, and I'm going to learn something from it. And so how am I going to overcome that, right? Daljit's got a comment. Is it worth looking at putting the patient in the middle, and then all the stakeholders look at what they can all bring to the table to improve patient outcomes, experience, and health? This way, like you said, Komal, there's no competition within the different specialities, but everyone can put their knowledge and roles into to get a better outcome for the patient who ultimately, wants the help. I think that's such an important point, Daljit. I think that touches upon this whole concept of having multidisciplinary teams, but in primary care, right? Which is essentially what's happening in the PCN. You have got multidisciplinary teams, right?
Yeah, definitely. And I think when we did that with COPD pathway, when we looked at it we had an FCP leader session, and the pharmacist was like, oh, okay, like that's what you do, and this is your background, and this is your experience. So absolutely, that's the dream. That's integrated care. The patient should always be at the center. I don't know why they're not. And if we operated like that, I think it would be a lot easier and an enjoyable place to be, because there wouldn't be competition. I don't think there's competition in primary care the issue primary care networks is there is a lack of understanding, but maybe if we did have more conversations where we said, okay, we've got Mrs. Jones and this is what she needs. Let's go. What does she need? Who is best placed to support that? That would be a very difficult conversation versus 10-minute consultation appointment times and things like that. Definitely.
Yeah. But these sorts of case studies, are really important to understand, okay, which professions can come into play, with a particular type of patient or a particular group of patients, and how can they support that patient along the pathway, along their care pathway, because different professionals will come in at different points.
Yeah.
For a patient. And some professionals may come in more frequently than others, and so it's kind of looking at that from that angle and saying, okay, well, if the pharmacist is a person who's supporting this patient month in, month out, and actually the doctor only sees that patient once every 6 months, how can we build the system so that it enables those pharmacists to be able to get the support that they need and be able to communicate with the relevant healthcare professionals as and when the patient needs.
Definitely. Yeah.
Oh, you know what? I could continue talking about this all day, and I've just realized that we're coming up to 40 minutes now. So, I think this is such an important conversation, and I think I've learned so much from having this conversation with you, Tara, about how pharmacists can approach that PCN role, and how you can kind of really go into that with your eyes open, and how you can actually, once you're in there, actually start affecting change within it. And I think that's a really important point that you've raised through the discussion about, breaking down those barriers by actually making your voice heard, making it clear what it is that you want to achieve. Once you're in there, getting a feel for what it's like within the PCN and where you can actually support better or, you know, a particular cohort of patients better, and really kind of going all in on that. And I think that's really, it's really great, you know, really great to hear.
Definitely. I think the last thing, I think you may have said, like implied it, but get to know your GP partners, get to know your CV, get to know your GPs, get to befriend your practice managers. I think you just need a couple of people understand what you do. And it's like, you know, like a positive, you know, testimonials. They will be like, oh, do you know what, Komal did this. Sometimes you need to go the extra mile. You know, like, I mean, not even the extra mile, it's like the extra 10 minutes.
Yeah.
You know, that reciprocity, you know, they'll be like, oh, Komal, thank you so much. And I'll be like, oh, do you know that Komal did this? And, you know, I've had networks where they're like, don't take Renars, you know, she's ours. You're like, embedded, you know, it's a lovely problem to have. It really is. So I would say, not to put it all on you guys, but if you love your role, you see the potential, I would get networking. And yeah, sometimes giving a little, even if you think, oh, I shouldn't have to do this, you just try it and see what happens.
Oh, do you know what? There's so much in what you've said just now that I think every one of us can take away about reciprocity and, you know, just giving that little bit to others. I thank you so much for that, Tara, because it's always great to talk to you anyway. I always love having these conversations with you. And, you know, and it's really great to hear this perspective from somebody who isn't a pharmacist, actually, you know, and who kind of has that oversight view. And it's really great. I'm so grateful that you came on and we could have this conversation. Thank you so much. Where can people find you?
I hang out a lot on LinkedIn.
Yeah.
But we've got loads of resources for primary care networks on our website at www.thcprimarycare.co.uk.
Fantastic. So go check Tara out. If you are remotely interested in PCNs, you've got to go and check THC out. Thank you so much for your time, Tara. Really, really appreciate it. And I'm going to see you soon.
Thank you.
Bye. That was Tara from THC. And you know what? I really enjoyed that conversation with her. If you are watching this again later on and you've got more questions, then feel free to drop them in the comments. And I'm sure Tara and I will be able to come back to you on them. And yeah, if you've got any other topics that you want to have talked about on the Happy Healthcare Professionals live show, then drop me a message. I would love to know what they are, and I'd love to bring those conversations to you. So thank you so much for joining me today. Really, really enjoyed that conversation, and I will see you on the next Happy Healthcare Professionals live show. Take care. Bye.